All right, good evening, everyone, and thanks so much for joining our Men's Health webinar. My name is Amanda, and I'll be the host of tonight's event. So we'll start with just a couple quick housekeeping items, and then I will introduce our speaker. So first, your participation tonight is completely anonymous to other attendees, so nobody can see your face or your name, and any questions that you ask will only be seen by myself and our physician. We love collaborative presentations, so if you'd like to ask a question, please type it in the chat box at the lower part of your screen, and we'll save time at the end of the presentation to answer as many as we can. Our presentation tonight will last for about 45 minutes and will be presented by Dr. Saneal Rajanahally. Dr. Rajanahally attended medical school at Baylor College of Medicine in Houston, Texas. He completed his urology residency at the University of Washington Medical Center before moving back to Houston, where he was accepted to a male reproductive medicine fellowship again at Baylor. After completing his fellowship, Dr. Rajanahally joined Urology of Greater Atlanta, where he specializes in treating erectile dysfunction, infertility, and other men's health conditions such as low testosterone. However, he treats all patients for general urological conditions. We are certainly lucky to have Dr. Rajanahally's unique skill set in the Atlanta metro area. Dr. Rajanahally, thanks so much for giving up your evening to give us some education. I know you have a lot of good content to cover, so I will turn it over to you.
All right, thank you, Amanda. Thanks for the introduction. Good evening, everybody. I'm excited to be here with you tonight. Thank you for tuning in. Today, we're going to be talking about erectile dysfunction, which is an often overlooked subject that can be sensitive to some, but I'm here to hopefully break some of that stigma and bring it sort of to the forefront. So what is erectile dysfunction? Erectile dysfunction is described or defined as the inability to achieve or maintain an erection that is firm enough to have satisfactory sexual intercourse. Now, lots of men will have an issue with an erection, at some point in their lifetime. But when we talk about erectile dysfunction, we're talking about sustained difficulty in maintaining or achieving an erection. Just how common is erectile dysfunction? The answer is it's very common. About 1 in 5 men 20 years or older experience erectile dysfunction at some point in their life. And more than half of men over 40 have some form of erectile dysfunction. And taking into account all of this, there's approximately 30 to 40 million men that may have some form of erectile dysfunction. We're going to look at sort of how a normal erection works. These are two pictures of what we call cross sections of the penis. So on the left side, this is the penis in the flaccid state. So there are two separate erectile bodies that are called the corpora cavernosa. And when you are aroused, the nerves that supply blood flow to the penis are activated. And this causes the muscles around the penis to relax, increasing the blood flow into those chambers. As the penis starts to engorge or swell because of the increased blood flow, this causes compression of the veins. So you have less blood flow out of the penis while you have increased blood flow into it. If you have problems with any of these things, the nerves or the blood vessels, you could have an issue with erectile dysfunction. So what are some of the causes and other associated conditions when we talk about erectile dysfunction? The three major sort of associated factors with erectile dysfunction are problems with vascular disorders or the blood vessels, meaning arteries or veins, such as heart disease or peripheral vascular disease, diabetes or high blood sugar, and medication side effects. The most common culprits in terms of medications can often be antidepressant medications or medications for high blood pressure. However, in our patients, specifically urology patients, there are also other causes. Those patients who have had pelvic surgery down in the pelvis for either prostate cancer or sometimes for even colon or rectal cancer could have problems with erections. There are also nerve issues, such as patients who are paralyzed. Sometimes the nerves between the brain or the spinal cord and the penis can be affected. Endocrine problems, such as your hormone levels, and about 1% of the time, or less than 10% of the time, I would say there's an unknown cause for the erectile dysfunction. We're going to take a look at sort of some of these comorbidities or associated conditions in a little bit more detail. When we talk about diabetes, there's about 15 million men in the United States, probably higher now, this was back in 2015, who have diabetes. We know several things about men with diabetes and erectile dysfunction. those men with diabetes and erectile dysfunction tend to be less responsive to oral medications for erectile dysfunction. In men with diabetes, the erectile dysfunction tends to be more severe if you look at them at an age, any age. And in some patients, erectile dysfunction can actually be the presenting symptom of diabetes. When we look at heart disease, the symptoms of heart disease may actually develop after erectile dysfunction, usually within 2 to 3 years. So what we know is that erectile dysfunction can actually be an independent risk factor, meaning that it can occur prior to any future heart-related events, such as a heart attack. And the severity of erectile dysfunction is actually correlated with the extent of the blood vessel disease to the heart. ED, erectile dysfunction, if we sort of shorten it as ED. So ED can precede, meaning it comes before problems with your heart in almost 2/3 of cases. So why is that? This is sort of looking at a schematic of just cross sections again of blood vessels or arteries. And so there are 4 sort of arteries that are shown on this slide. The penile artery on the left side is about 1 to 2 millimeters in diameter, whereas the main artery supplying the blood to the heart is about 3 to 4 millimeters in diameter. The other 2 are the internal carotid artery, which is in your neck, and the femoral artery, which is down in your leg. So you can see that the penile artery is actually the smallest of the 4 blood vessels. And you can imagine that if you have hardening of the artery or somewhat of a blockage in the artery, that potentially the first one to be affected. And what we do know is that once that artery becomes about halfway blocked, you may start to have some symptoms of erectile dysfunction. With respect to testosterone levels, I'm sure you may have heard about low testosterone through the radio or through advertisements. It's highly advertised at this point, but there certainly is a link between low testosterone and erectile dysfunction. As men age, there's definitely a decline in testosterone levels, but we only treat low testosterone if you have symptoms associated with it. And so low testosterone essentially happens when your body's producing less testosterone than normal. It is more common in men with certain medical conditions such as obesity, diabetes, blood pressure, and cholesterol issues. And it's a rather common condition. Approximately 40% of men over the age of 45 may have low testosterone, but again, we don't treat it unless there are symptoms associated with it. In terms of treatment options for low testosterone, just briefly, there are multiple treatment options, and the focus of this is not to talk about testosterone itself. However, I'm happy to talk to you more about that in person if you would like. There are many, many treatment options. There are gels, there are patches, there are injectable therapies. Sometimes there are oral medications, there are pellets, and the newest sort of FDA-approved treatment for it is a nasal gel. So how does pelvic surgery affect your erections? The nerves and some of the blood vessels that supply blood to the penis for an erection are in very close proximity to the prostate and may be injured during prostate cancer treatment. So you can see on the right side in that top picture that the prostate is removed by making cuts along the bladder as well as the urethra. And then that tissue is removed and you have to sew the bladder back to the urethra. The nerves are very close to here, and sometimes the nerves can be damaged when you do this. Now, the goal of prostate cancer surgery is obviously to treat the prostate cancer, not to leave any cancer behind. So sometimes these nerves have to be taken as well. And so obviously, when you have nerves that are in this close proximity, you can have trauma to those nerves and cause erection issues or ED. The same can be said for radiation therapy as well for prostate cancer. So when we look at sexual dysfunction after prostate cancer treatment, after radical prostatectomy or removal of the prostate gland, approximately 25 to 75% of men can have some form of ED. And with respect to radiation therapy, up to 50% of men can have problems with ED. Now, the timing of the ED can vary based on the treatment. With radiation therapy, you may not notice an issue with your erections initially, but you may notice over the next several years that you have a progressive decline in your erectile function. After surgery, many men will be immediately impotent, or meaning that they have immediate erectile dysfunction, and the inability to achieve an erection, but they could have an increase or an improvement in their erectile function, usually for up to 12 months after the surgery. And sometimes other therapies can help to kind of increase that chance of not having permanent erectile dysfunction during that first 12 months. Another potentially associated condition is something called Peyronie's disease. Now, Peyronie's disease is a curvature of the penis, okay, and it can curve in any direction. It's typically something that happens after some sort of traumatic event. And there's two phases to it. There's sort of the acute phase where you have pain with erections. You may start to notice a curvature starting to develop. And then there's what we call the chronic phase, once the curvature has sort of stabilized and you no longer have any pain. Now, there is an association between erectile dysfunction and Peyronie's disease, and each of them have their own treatments. And you can imagine that, if Peyronie's disease is associated with trauma to the penis, that if you're having problems with your erections and you're not as firm as you were previously, and if you have some sort of traumatic event during sex, then this could lead to some curvature. So what are the treatment options for erectile dysfunction? This slide is sort of an overview of the major categories of treatments, mainstream treatments. And it used to be that we would go through sort of a stepwise fashion in terms of the treatment. So you'd start on the left side and you'd move, across towards surgical therapies. But nowadays, through the American Urological Association, which is our national guidelines, it's recommended that we have an upfront conversation with men who have erectile dysfunction about all the treatment options. And depending upon the patient and partner's goals, any treatment could be an option at any point. So oral medications are all part of a class of medications called phosphodiesterase inhibitors, or PDE5 inhibitors. And how do these medications work? They work by increasing the blood flow to the penis to help hopefully maintain or create an erection. About 60 to 80% of men have a good success rate with these types of medications. Some of them, there are several types of PDE5 inhibitors within this class. And some of them are affected by food in terms of being absorbed and thus can have a different effect on your erectile quality, while others are not affected by food. What are the side effects related to the medication? Well, the side effects can be related to increased blood flow to the other parts of the body. So just like you can get increased blood flow to the body or to the penis, you could have increased blood flow to the head, which would cause a headache. You could feel like your face is warm or flushing, or an upset stomach. You do have to, there are some other medications that will interact with these PDE5 inhibitors, and those need to be taken into account. And then down at the bottom, it says that men with diabetes, may respond to these medications, but oftentimes will have to move on to other therapies. And almost half of men with erectile dysfunction who try oral medications may eventually find that they no longer work or need to move on to another treatment modality. Look at injectable therapy. This is sort of a self-injection technique to help increase blood flow to the penis. So, typically the way this is done is it's done along the shaft of the penis, as you can see on the right side, using a small needle, similar to the needles that diabetics will use. And it will help you to create an erection, usually in about 10 minutes or so. And it's fairly effective, but despite their success rates, a lot of men have difficulty with this due to either pain associated with it or difficulty manually injecting into that area. There are some side effects such as penile pain or an erection that could last too long, but that's why we start you at a low dose if this is something that you're interested in, and we slowly work our way up to find the right dose to get you an erection that lasts about 30 minutes would be ideal. The most common reasons to stop the medication would be, like we discussed, dislike of injections. Some people have a fear of needles, pain related to the injections, or they just don't have a good response to the injections. There are also vacuum erection devices, or sort of commonly known as, some men will call this a penis pump. And essentially the way that it works creates a vacuum that pulls blood into the penis. And this can be used in combination with some of the therapies mentioned previously. And then you place a small constricting ring at the base of the penis to keep the blood within it. Satisfaction rates for this vary as well. And side effects can be related to pain, again, some bruising, discomfort from the ring. And then some men will say that they have difficulty ejaculating because of constriction around the urethra related to that ring. There are also urethral suppositories, or small little medication pellets that you can insert into the tip of the penis. This medication it helps to create an erection within 5 to 10 minutes as well. It has somewhat lower success rate and often is discontinued due to pain or some bleeding from the urethra. It can be absorbed into the bloodstream and cause some issues with blood pressure. And it can be a difficult medication to obtain and oftentimes can be expensive. There is a high rate of failure in men who have had a previous prostatectomy for prostate cancer. And then there's surgical therapy as well. So this is a picture of a penile implant. A penile implant has 3 pieces. There's a reservoir that holds fluid. There are 2 cylinders that go in the penis, and then there's a pump down in the scrotum. And we're going to go through this in detail, and I'll also show you a little video. So the way that this works is the pump is down in the scrotum. All of these pieces are on the inside. You can't see any of it from the outside, and nobody would know that you had this device unless you told them. So basically what you do is you squeeze the pump that's down in the scrotum, and this causes fluid from the reservoir to go from the reservoir into the cylinders to create an erection. They have these devices have been around for a long time, 40 years or so, and greater than 90% of men report that they have good erections with this device. And about 7 years after surgery, more than 90% of them are still working, okay? The most common side effects as seen here are postoperative pain or infection, which we'll talk about later, as well as malfunction of the device, which would require replacement. So this is the 3-piece penile prosthesis, which we just discussed, and this device is coated actually with an antibiotic to hopefully decrease the chances, and it's been shown to decrease the chances of infections with this type of surgery. And again, as mentioned, this has been penile implants have been in clinical use for over 45 years, and many, many men have had this surgery done with good effect. So we're going to watch a quick video here regarding how this device works, and I'm going to advance this a little bit so we can kind of get to the important part of it. So, okay, so here's a little animation. So you basically pump the pump that is down in the scrotum using your index finger and your thumb. This causes the fluid from the reservoir to go into the cylinders of the penis to create an erection. When you're finished, you hit the button with activity, you hit the button on top of the pump, and this causes the fluid to go back into the reservoir. And if you need to make it quicker, you can actually just squeeze on the penis as well, and that will make the fluid return to the reservoir. So what to expect for the procedure? It's usually performed as an outpatient procedure under anesthesia. And so I do this as an outpatient procedure. It takes about 40 minutes to an hour to do the surgery. I create a small incision in the scrotum, and all of these components are implanted through this area. It generally will take, would take a few days to return to your regular routine or light activity. You will have a catheter in your bladder that drains the bladder overnight, and the catheter comes out the next day. I will have a wrap around the whole area, which typically will come off about 48 hours after surgery. And then I see you usually about 2 weeks after surgery just to make sure everything's going well. And then about 4 to 6 weeks after surgery, I'll see you again, and we'll make sure that the device is working and that you're cleared to use it. A lot of men have concerns about the cost and coverage. The insurance coverage for erectile dysfunction treatment varies. Coverage may be available under Medicare and Medicare Advantage. However, once you come in, and if you're interested in having a surgical procedure done, our office will work with the insurance carrier and figure out what your out-of-pocket responsibility would be and what the insurance would cover. And there are also financial assistance options. There are certain risks associated with any surgery. Anytime you do surgery, there's a risk of bleeding, there's a risk of infection, risk to injuries around the site where we're putting the device in. There's about a 1% to 2% risk of infection with these devices, which would require removal of the device in most situations. But we give you antibiotics at the time of the procedure, as well as as well as afterwards, to try to prevent this from happening. There also, like we mentioned before, can be failure of the implant to function, as well as pain associated with healing. So the benefits, as we discussed, there's a high rate of patient and partner satisfaction, greater than 90%. It's a long-lasting device. Again, 90% are still working at 10 years after surgery, and it's totally concealed. And it doesn't affect your sensation in terms of what you feel when you have sex, and it shouldn't affect your ejaculation either if you were ejaculating normally previous to surgery. There are some newer treatment options that are not at this point approved or FDA approved for treatment of erectile dysfunction. You may have also heard radio advertisements or marketing efforts related to these treatment modalities, including shockwave therapy, stem cells, and platelet-rich plasma, or PRP therapy. So shockwave therapy is sort of the one that is starting to become more and more mainstream. This is the type of therapy that essentially creates small waves to the penis over multiple treatment courses. And essentially the goal from that is to create small trauma to the penis over time, which will increase blood flow and restore erectile function. Now, there is, the American Urological Association at this point states that all of these therapies are investigational. And, there are certain candidates that may benefit from this, but overall right now, they are not FDA-approved treatment modalities. So in summary, erectile dysfunction is a common problem and can be associated with many other medical conditions. There are several treatment options, and the penile implant can offer a long-lasting and satisfactory solution depending upon patient and partner preferences. If you would like to schedule an appointment at any point, you can visit us online at ugatl.com, or you can call the phone number listed below. I've also included a link here for my personal channel, vidscript.com/Saneal Rajanahally, which has all of sort of the preoperative and postoperative expectations regarding the surgical procedure that I've recorded specific to the type of surgery that I perform. Thank you. And at this point, I'll open it up to any questions.
Thank you so much, Dr. Rajanahally, for taking the time to do that presentation for us. So just as a reminder, if you have a question for Dr. Rajanahally, you can put that in the chat box at the lower portion of your screen. And I just like to remind patients, Dr. Rajanahally is going to leave this up on the screen for a minute if you want to grab a pen and paper and jot down this contact information, or you can even grab your cell phone and take a quick picture of your screen while we answer some of these questions. So Dr. Rajanahally, we'll start with one that we get pretty often. So is there anything that can be done to prevent ED?
Yeah, so that's a great question. So I always like to say to patients,